Wow, there is early data on a drug made by Gilead that suggests patients are responding to treatment. Now, this is everywhere in the news. The media is very excited. We only have a few data points right now, and they're in phase 2 of the 3 phases for their clinical trials, but it's very promising. And the stock market is going through the roof. However, The Hill would like to remind you that Rita Wilson experienced extreme side effects of hydroxychloroquine. Family of a New York woman blames hydroxychloroquine combination for a fatal heart attack. French study now from CNN finds that hydroxychloroquine just doesn't help any patients with coronavirus. Same from Reason. It's just very disappointing. And then you have this story, a local story from Dallas. 39 elderly Texans successfully complete hydroxychloroquine treatment for COVID-19. They completed a 5-day treatment, and their doctor said none of the patients experienced side effects. And maybe they're all dead now. We're not sure. Oh wait, we have the doctor on. Dr. Robin Armstrong, medical director at the nursing home, the resort in Texas City. He has his BS in microbiology from Texas A&M, MD from the University of Texas Medical Branch in Galveston. And his wife is a doctor, so he's got something going on. He's not a vet. So let's talk to Dr. Robin Armstrong. Hi, Doc. How are you?
I'm doing well, and yourself? Thanks for having me on.
You bet. I'm excited to hear the results of the 39 patients. What happened?
So what happened with our patients that we treated with hydroxychloroquine, azithromycin, and zinc is we've had great results. We've had one patient that passed away from other causes, not coronavirus likely, but all the other 38 have done well with the regimen. And so these were all elderly patients as well, in nursing homes. And so these were patients that, by and large, range from the ages of probably 55, but really chronically ill, to 102. And so we had a wide range of patients. Most of them are all above 70 and 80. And they actually tolerated the medication well. We monitored them closely, did not have any side effects from the medications, and they've done very, very well. In this cohort of patients, you would expect a certain number to go to the hospital. You would expect a certain number to succumb to the illness, but that just didn't happen in our case and with our observations.
Okay, so are any of them now COVID-free-ish? I mean, as free as you get with this.
So as of yesterday, was 2 weeks post-testing. Their test was on April the 2nd. So they finished 2 weeks yesterday. We're going to retest them actually on Tuesday of next week and then make that determination. We certainly think that they're out of the woods as far as a serious medical illness from COVID-19 at this point, because they're both they're all 14 days out. And on Tuesday, they'll be 2 weeks from the treatment as well.
So, doctor, there are stories of people that have taken this and said, within a few hours, I turned, for the better. I started making the turn. Have you seen any results like that? Were they going in the wrong direction and this turned it around, or do you have any real results that you could say this was effective?
Well, in our observation, I would say that the only patients that we treated on this regimen, we had about 56 positives. We didn't put everybody on it because we put folks on it who were getting worse. We put folks on it in the nursing home. Our goal was to manage them there in the nursing home. And if they started getting more short of breath, if their oxygen saturation started to decline, or they started having a fever, we would start the medication regimen at that point. And what we saw was the patients started to get better. They either maintained where they were, or they slightly got better, and over time, all of them got better. And so we've seen a significant improvement in them. And so, like I say, in our small observational study, our patients certainly have gotten better. The health department director says, you would expect percentages to be much higher, percentages of death, percentages of hospitalization, and we just saw none of that. And so in my observational study, we saw folks improve, and so that's pretty exciting for us because we're about saving lives, and that's all we're about.
All right, so let me take you here. There is a report out that's been circulating this week, and it started with this woman in New York who is now suing because she said that it was the combination that caused a fatal heart attack, and even I know that just talking to my local doctor, when he looked into this, I called him and I said, what do you know about this stuff? He looked in and he said, hydroxychloroquine's been around forever. He said, it's safe. There's some eye problems, et cetera, et cetera. He said, but the combination of the two, he said, I wouldn't feel comfortable giving someone unless they were being monitored at a hospital because it can cause heart problems. This is nothing new. Every doctor knows that. That's one of the risks, correct?
Absolutely correct. And I'll tell you, so what the issue is, doesn't cause heart attacks. It can cause an arrhythmia with the combination, because what they do is they prolong the QTC interval, and that's an EKG finding that shows that they're predisposed to having a cardiac arrhythmia. Now, most cardiologists will tell you that in prolonging the QTC interval, very rarely see arrhythmias with them. But if you do see that prolonged QTC interval on the EKG, it says that they're predisposed to that. We actually checked EKGs on all of our patients in the middle. So on day 3 and day 4, we checked EKGs on those patients that were on the combination because I understood that concern, and none of them had a prolonged QTC interval. So none of them had the change that's indicative of cardiac arrhythmias. And so I don't think that that's actually accurate. I bet you if you go to any individual's medicine cabinet, many of those medications prolong the QTC interval. Antidepressants do, a lot of them do, and it's just sort of a common pharmacologic side effect of a lot of different medications. But it's very rare that they cause fatal arrhythmias. And in our study, we had 0 that had the EKG finding that would show that they would have an arrhythmia. None of them had arrhythmias, and none of them had the EKG finding consistent with arrhythmias.
We are hearing from doctors all over the country that are using this, that have seen results. I mean, it's not a cure-all by any stretch of the imagination.
Absolutely.
But yesterday, a few things have come out about the new drug from Gilead. It's not even through with testing. The stock market went crazy. CNN, all of New York Times, everybody went crazy. Oh, this is it. We finally have a cure. We don't even know anything about this drug yet, and I'm really excited. I hope that this is all true. But here's a drug that's been around literally forever, hydroxychloroquine, right, and it is being treated like a pariah. Do you believe that this is happening because Donald Trump was behind it?
Absolutely. I absolutely think that is the reason. I absolutely think that's the reason. I think that's why people I have been attacked when I've treated patients with this, and we've seen improvement in the patients. And so I believe it is a political agenda, unfortunately. And it's really sad to me because I've never allowed my political preferences get involved with my medical practice. And that's still the case. We've never allowed that to happen, and it hasn't happened in this case. And I think it's a shame that they've allowed this to happen. But even though I've seen great results, families are happy, the patients are happy, patients are alive, they didn't go to the hospital like you would expect. And so I'm really excited with the results. And so as a medical professional, morally, I was set up with a situation where I thought the outcome of this could be catastrophic. You could send all these folks to the hospital and expose EMS workers, ER nurses, and doctors, or you could manage them in place, watch their symptoms closely. We rounded on them every single day. We saw them every day to manage their symptoms and make sure they were not getting worse, started the medicines, monitored them closely on the drug in the nursing home, and saw an improvement. And so I'm excited about the results.
Well, I'd like to hear the results from the test again next week. Thank you so much. Dr. Robin Armstrong, from the resort at Texas City. He's the medical director at that nursing home. Treated 39 elderly Texans with the signs of COVID-19 for treatment for COVID-19. One passed away not from COVID-19, and the rest of them are getting better every day. Thank you so much. Appreciate it, Doc.
Thank you, sir.